Today, I want to share some insights into one of my favorite procedures. This is called an anterior cervical discectomy and fusion, or ACDF for short. If you've been living with neck pain, arm pain or weakness, numbness and tingling, you might benefit from an ACDF. As a board-certified neurosurgeon, I'm going to review why this surgery is performed, what it involves, the risks, the benefits, and what to expect during recovery. Today, I want to discuss with you a common spine surgery called an anterior cervical discectomy and fusion, or ACDF for short. This is a fancy way of saying that we enter through the front of your neck and remove a damaged or herniated disc from between your vertebrae. Then we fuse the bones together to stabilize your spine. This procedure is commonly done for conditions like herniated discs, degenerative disc disease, spinal stenosis, or bone spurs that compress the spinal cord or nerves, causing pain, numbness, or weakness. Let's discuss these symptoms in a little more detail. Radiculopathy is when a nerve root exiting the spine is compressed, causing pain, numbness, tingling, or weakness that often travels down the arm. Myelopathy is a more serious condition caused by spinal cord compression, often due to a bulging disc or bone spurs. This can lead to problems such as weakness, incoordination of the arms and legs, and even bowel and bladder dysfunction. Chronic neck pain involves persistent pain that doesn't respond to other treatments and is linked to a structural problem in the cervical spine. The main goal of an ACDF procedure is to relieve pressure on the spinal cord and nerves while stabilizing the neck. The benefits can be life-changing. This surgery can significantly reduce or eliminate neck and arm pain, restore strength and coordination, relieve numbness and tingling, and prevent further damage to the spinal cord or nerves. For many patients, ACDF surgery allows patients to experience a fast recovery with improved quality of life and minimal disruption of daily activities. People often quickly return to activities they love, pain-free. Let's discuss ACDF surgery step by step. I'm going to walk you through what happens during an ACDF surgery in a way that's easy to understand. You'll be completely asleep under general anesthesia. The surgery begins with an incision made on the front of your neck. This approach avoids cutting through the muscles in the back of the neck, and it allows us to have direct access to your disc. Once we make the incision, we gently move aside important structures like the trachea, esophagus, blood vessels, and we gain access to the spine. Next, we localize the damaged disc. Using specialized tools, we carefully remove the problem disc and bone spurs, creating space and taking pressure off the spinal cord and nerves. To stabilize the spine, we insert a small device, often called a cage, into that empty disc space. This cage is made of or filled with bone material, which helps the vertebrae fuse together over time. Oftentimes, we secure a small plate and screws to the front of the spine to hold everything in place while the fusion occurs. Then, we close the incision and the surgery is complete. Like any surgery, ACDF does have some risks, though they are relatively rare when performed by an experienced and careful surgeon. These risks include, but are not limited to, anesthesia-related problems such as breathing issues and heart complications. Blood clots, also called deep venous thrombosis, can form in the deep veins of your legs, then travel to your lungs and result in serious complications. Other risks include infection and poor wound healing, voice hoarseness or difficulty swallowing, which is often temporary, injury to the surrounding structures and tissues in your neck, including the esophagus, blood vessels, nerves, or spinal cord, failure of the vertebrae to fuse together, and some neck stiffness and decreased range of motion after surgery. You may develop additional wear and tear on the levels above or below your fusion, requiring additional surgery in the future. Hardware complications are rare, but screws, plates, and cages can shift or break. The good news is that ACDF is a well-established, routine procedure, and serious complications are very rare. An ACDF is often a very well-tolerated and safe surgery. Your surgeon will discuss these risks with you and ensure you're a good candidate before moving forward. Let's talk about what to expect after an ACDF surgery. After surgery, many patients notice immediate relief from arm pain and tingling that they had before the procedure. Recovery from numbness and muscle weakness, however, tends to be slower and less predictable. It may take several months to a year, and in some cases, these symptoms may not fully resolve. Now, we need to have a frank conversation about neck pain and managing expectations of neck pain relief after an ACDF. These results can vary. Some patients don't experience the full benefit of an ACDF surgery as it relates to neck pain until those bones have fully fused, which takes time. In the weeks following surgery, it's common to have an increased soreness in the back of the neck and between the shoulder blades. This discomfort is temporary and should improve as you heal. But it's important to understand that ACDF surgery targets a very specific spinal level. While it can be very effective for treating pain caused by issues at that level, it won't address other sources of chronic neck pain that may be present. Following an ACDF, you'll go home the same day or the next day with instructions to rest and limit certain activities. You may need to wear a neck brace temporarily to support your spine as it heals. Physical therapy might be recommended to help regain strength and mobility while minimizing scar tissue formation around the nerves. Most patients return to light activities quickly, increasing their activities gradually over time. This depends on the extent of the surgery, the patient's bone quality, and the surgeon recommendations. Here are a few important tips for recovery. Avoid heavy lifting, twisting, or bending of your neck until you're cleared by your surgeon. Take medications as prescribed to manage any pain or inflammation. Follow your surgeon's instructions regarding whether to continue or temporarily stop certain medications. Avoid nicotine products. Keep your blood sugars well controlled, and follow up with your surgeon for regular checkups to ensure your spine is healing properly. Remember, your recovery is a partnership between you and your care team. Don't hesitate to reach out with any questions or concerns. To wrap things up, anterior cervical discectomy and fusion is a safe and effective procedure for many patients suffering from neck and nerve-related issues. If you've been dealing with these types of symptoms such as neck pain, arm pain, numbness, tingling, or weakness, you might benefit from an ACDF. And if you want to learn more about your spine health, subscribe to this channel. I'll continue breaking down complex neurosurgical topics into simple, easy to understand discussions. Together, we'll explore how neurosurgery is helping people get back to the lives they love. Thank you for watching, and I'll see you next time.